So you're early in pregnancy and you've started bleeding. Hi, I'm Dr. Wilshire. I'm going to talk about first trimester vaginal bleeding in early pregnancy. The patients I see have been trying to get pregnant. They've been going to great lengths to get pregnant. The woman's finally pregnant. Everyone's happy. And then they have the dreaded bleeding. It can be terrifying, can be very upsetting. We need to talk about this. It is usually not horrible bad news, and it's usually not an emergency. If you look at women with regular, healthy, routine pregnancies, at least a quarter of these women will have some type of bleeding. It can be light pink, it can be kind of brown, maybe some brief episodes of bright red bleeding, and it's very, very common. A pregnancy needs to grow a placenta into the wall of the uterus. It needs to invade and wrap around blood vessels, and you can imagine this process is fraught with potential problems, and you can see it would be very easy to erode into a blood vessel, have a small leak, have some blood come out, and it doesn't mean there's any problem. Bleeding from the vagina can come from many different places. It doesn't have to be coming from the pregnancy up inside the uterus. It can be coming from the cervix or someplace lower. A woman's been using progesterone suppositories or has had a bunch of procedures on the cervix, perhaps the cervix is raw and it's bleeding and the pregnancy above is doing just fine. Women have a 2 to 3% chance of having something called an ectopic pregnancy, however, so if bleeding persists, we certainly recommend you call your doctor and get a sonogram very, very quickly. Now, women who have miscarriages only have bleeding prior to the miscarriage about half the time. At least half of miscarriages come on suddenly. There was no bleeding. There was no indication of a problem. Then all of a sudden, a woman gets bleeding and cramping and has the dreaded miscarriage. Now, this is rarely an emergency. If the bleeding is very heavy, however, if it's very painful, particularly on one side of the pelvis or the other, or if you have, as a woman, signs of fever or illness and there's something just wrong, these certainly need to be seen generally fairly quickly. Now, in my experience, going to the emergency room is generally a bad idea unless symptoms are really, really bad. Now, if you live in a rural area and you cannot get to your OBGYN doctor or your reproductive endocrinologist, well, then maybe an ER is a good idea. But most of the time, emergency rooms cannot help you. You end up getting charged a lot of money. And most of the time they say, call your OBGYN in the morning. So don't have a knee-jerk reaction to go to the emergency room unless you have those severe symptoms I just mentioned. Obviously, if you're bleeding, you should avoid irritating the cervix. Do not have sexual intercourse. Do not use tampons. Make sure you put in suppositories gently so you don't stir up any bleeding that you don't have to. We can almost always fit an emergency visit in my office for an ultrasound. We can always find 5 minutes, have a woman come in. We do a vaginal ultrasound. We're looking for a sac, a pregnancy sac in the uterus. If the sac in the uterus is in the right place, if it's growing appropriately, and if we have a normal heartbeat, chances of a true miscarriage should be less than 10%. So these ultrasounds can be very reassuring, and they can generally rule out very serious problems, such as an ectopic pregnancy I mentioned. Now, in my world, we do a lot of in vitro fertilization, which requires an embryo transfer, where we put an embryo up inside the uterus. The uterus must be prepared for pregnancy, and the combination of preparing the uterus and doing the IVF and whatnot is associated with a much higher incidence of bleeding or spotting or some type of issue such as that in the first trimester. In women who've had their uterus prepared with estrogen and progesterone, risk of bleeding after an embryo transfer in early pregnancy is as high as 50%. This is seen worldwide. When we do sonograms, sometimes we'll see a pocket of blood underneath the edge of the placenta. It's called a subchorionic hematoma. Believe it or not, these hematomas are not associated with an increased risk of miscarriage. It sounds counterintuitive. We always give women recommendations to avoid miscarriage, and avoid high impact activities, etc. But in general, these hematomas do not seem to cause miscarriages. Sometimes some clinics, and we're doing this more often, are suggesting you take a little more progesterone. Certainly can't hurt to do that. Now, where possible, we're beginning to prepare the uterus with a woman's own hormones. We're giving medications to make a woman ovulate. And if a woman makes her own estrogen or progesterone, or we only supplement that, we are seeing decreased bleeding and perhaps higher success rates. In order to do that, however, a woman has to be able to have a normal ovulation, and frequently that's just not possible, and we have to do what we call program cycles. So in summary, bleeding in the first trimester is very common. It's usually not a big deal. Sometimes it is, and being evaluated properly by your reproductive endocrinologist or your OBGYN, usually in the office, is always a good idea. I hope that's reassuring. I hope all your hard work pays off for a healthy, successful pregnancy.